È per questo che sto per firmare un provvedimento che possiamo sintetizzare con l'espressione "io resto a casa". Saranno quindi da evitare su tutto il territorio della penisola gli spostamenti, a meno che non siano motivati da 3 specifiche circostanze: comprovate ragioni di lavoro, da casi di necessità o anche per motivi di salute. Aggiungiamo in questo provvedimento anche un divieto degli assembramenti all'aperto in locali aperti al pubblico. Non ci possiamo permettere più queste occasioni di aggregazioni che diventano occasioni di contagio. Credetemi, non è facile. Sono pienamente consapevole della responsabilità e anche della gravità nell'adottare queste misure per tutta la penisola, ma sono costretto a intervenire in modo ancor più deciso.
Morning breaking over Milan. By the time people woke up here, normal life had been suspended. After nearly 6,000 cases of COVID-19 and more than 300 deaths, in the early hours the Italian Prime Minister announced drastic limits on people's lives.
Noi vogliamo garantire la salute dei cittadini.
We want to protect the health of all citizens. We are aware that this will create unease and that these measures will be a sacrifice, big and small. But this is the time to be responsible.
16 million people are now living under strict conditions. The entire region of Lombardy, home to the financial capital Milan, is under lockdown. But so are more than a dozen provinces and Venice. You can't enter or leave these red zones without an exceptional reason. Gatherings like weddings and funerals are suspended. Restaurants and cafes can open till 6 p.m, but must keep customers 1 metre apart. Unfortunately, many people slipped out of the region before the shutters came down. News of the lockdown was leaked last night, giving people the chance to flee south. People are being urged to stay put and stay at home. But Sophie Bevan, whose family lives not far from Milan, says some are ignoring the rules and no one's really enforcing them.
People are still going on trips, they're still going down the supermarkets. Luckily, as of this weekend, they've closed all the shopping centres. The shopping centres are now closed every weekend. They're open during the week, but they're closed every weekend. But you'll get groups of kids who have nothing to do at home, who will take a bus, because the buses are still running, and go down to the local shopping centres and hang out, as if there were nothing wrong. And people just don't appreciate the seriousness of it.
Perhaps to ram it home, the Italian government has released these pictures of a woman in her 60s with coronavirus being flown by military helicopter to a Lombardy hospital. Here we've not seen anything like the spread of the virus in Italy. 273 people in the UK now have COVID-19. The government hasn't reached for so-called social distancing measures yet, but it is introducing emergency legislation to protect the jobs of volunteers like the St John ambulance, so they can stop work for 4 weeks to help the NHS.
We have around 10,000 committed volunteers who week in, week out help out in their communities, and we're talking about what role they could play going forwards. Receiving paid time off work to volunteer for us would be a new step, but it's something that we will explore with government because we want to play the fullest part possible in supporting the nation at our time of need.
Shoppers emptying shelves have forced 3 stores into rationing. Tesco and Waitrose online restricting sales of some antibacterial wipes, Asda some hand sanitizer. The Prime Minister said people don't need to stock up.
We've had no advice from the scientific advisors or the medical officers that there's any need for people to buy stuff in. If you think you've got symptoms, then the best thing to do, as you know, is to stay at home, contact the NHS. And yes, absolutely, we will make sure that we give the NHS all the support, all the investment it needs to cope with this crisis.
In the US, nearly 500 people in 32 states have tested positive for the coronavirus. 19 have died. Today, Democratic presidential candidate Bernie Sanders said campaign rallies could have to be cancelled. But in China, the number of new infections is falling rapidly every day. 57,000 people have recovered from the disease there.
We are very looking forward to going home.
Here, 32 people were also on the way home after their 2-week quarantine on the Wirral, a precaution, but we may see more preventative measures in the coming weeks.
Well, earlier I spoke to Dr. Rifat Atun, Professor of Global Health Systems at Harvard University, and I began by asking him whether he thought the UK government should be acting more aggressively in dealing with the outbreak.
There's a very fine balance between being highly alarmist but also having delayed action. What's important is that the government or the relevant authorities regularly monitor with strong surveillance system exactly what's going on and take action. But certainly one can take many actions, for example, reducing all unnecessary travel, reducing unnecessary non-essential domestic travel, avoiding large crowded meetings. These will certainly help, reduce the peak in terms of the number of cases, but also delay the epidemic to give us more time to prepare and to react.
So when you look at the fact that Italy has now locked down the entire region of Lombardy, have governments around the world got to think the unthinkable with this disease? I mean, are we going to see at some point in the future London being locked down with a population, Greater London's got a population of 9 million. Is that possible?
If the numbers continue to rise, that is going to be one way of containing or delaying this epidemic.
When you look at how differently countries around the world are handling this, I'm thinking about, for example, Singapore had its first confirmed case on January the 23rd. The UK didn't announce its first confirmed case until over a week later, yet now we've got 273 cases, they've got 150. Obviously different population sizes, but is there a different approach being adopted that the UK could learn from?
Singapore had good experience from the SARS outbreak in the past, so they were able to act decisively and quickly, and they had systems in place to ensure that the policies were cascaded very rapidly. They were able to trace contacts. With the UK being a much larger government and a much larger country, sometimes the policies are more difficult to implement.
So if you were advising Boris Johnson, Prime Minister Boris Johnson, right now, what would you be advising him to do this week to get a grip on this situation so we don't see what's happened in Italy?
What's important in situations like this is that the authorities have full trust of the population. So transparency, regular updates on the situation is critical. Communication is very important. And rather than delaying action, one would have to take certain decisions, maybe in some pockets, as Italy did early on in Veneto and Lombardy region before the lockdown, maybe close off some areas and maybe ban large meetings because we really need to reduce transmission and delay the epidemic so that we have enough time to respond. Otherwise, the health system will be overwhelmed.
Rifat Atun, thank you very much.
Thank you.
The Italian government announced today it is imposing strict new rules to prevent the spread of coronavirus. We're going to show you a shot of Milan there, the country's normally bustling financial capital, essentially on lockdown. About 16 million people in northern Italy will be placed under a travel ban for a month. It's the toughest attempt to contain the virus outside of China, and the first time such a measure has been taken in Europe in centuries. Megan Williams has the details from Rome.
These are drastic and massive measures for Italy. As you mentioned, we're talking 16 million people that have essentially been put into quarantine. Now, the areas that have been shut off are in northern Italy, Lombardia, which is the region around the city of Milan, and 14 other cities and areas around there. So these are people who now cannot enter or leave those areas. They've also been told to not move within them too much unless they absolutely have to get to work or for health emergencies. Gyms, schools, universities, all sorts of places where people congregate have been fully shut down. Restaurants are open till 6 o'clock, but people have been told, as they have been told across the country, to keep at least a meter's distance from other people. Now, the biggest concern about this drastic and necessary measure is the impact on the Italian economy. Italy still has not fully recovered from the recession. 10 years ago, it has struggled in and out of shrinkage, and experts are saying this will definitely lead to Italy entering another recession. That area in northern Italy that is now essentially under lockdown comprises about a third of the country's GDP. So to have that economy frozen, even just for a month, is a massive impact on the whole of Italy. Megan Williams, CBC News, Rome.
We're going to turn now to Leila Bicher. She is a pharmacist who is affected by this lockdown, and we've reached her near Milan. Thanks so much for joining us, Leila.
Thank you. Thank you for having me.
Our pleasure. Let's talk about what the lockdown is like in your town.
Well, I live in Casapusterlengo, which is one of the second town that got in lockdown 2 weeks ago. We are starting now our third week. And during the night, this lockdown spread to the whole region. So the whole Lombardy now is in lockdown. For me, personally, it's necessary. I think it was necessary way before. When we started our lockdown, I think everybody, the whole region should have been put in lockdown back then. And we're not panicking. We're doing good. We're holding our positions, and we understand that this is necessary, so we do so. We stay in lockdown.
So when we use the term lockdown, what does that mean for daily life? What do you do for shopping and for food? And do you not go out of your house at all? Just describe what a typical day is like for you and your family.
Okay, for me, it's still pretty much the same because I'm a pharmacist, and pharmacies kept being open for the whole time. So I never stopped working. For my husband, he stopped this 2 weeks because we were in the red zone. Now the red zone is the whole region. So now things are changing because we are going back to normal activities, even though they are very strict. We are allowed to leave our houses to do, in order to get the basic things done. So get food, get medicine. And now we can go to work, but we have to keep distance when we work, and we have rules to follow. So mask and the distance, and we have to avoid get together in big groups to congregate. And the main part, the main part of this lockdown is to have kids at home because schools are closed, and they're going to be closed till April the 3rd. So that's going to be a problem because my husband is going back to work. I'm working, so we haven't figured out how to do the twins yet. We're not sure who's going to take care of them because my parents are 25 kilometers from here, and they could take care of them, but it's better if they don't come here, and we don't move the twins to go there. So it's hard. The situation is not clear now.
As a pharmacist, you must be dealing with people every day who are concerned about their health. What sort of reaction are you getting from people, and especially your customers?
Now, people are afraid because the cases of infection increased during these weeks, and our hospitals are full. Our intensive care units are getting full. There are really few spots open, so now it's a critical situation. It is really. So if please you would let me, I would say to people, stay at your house. For real, this is important to people, not to get together and stay at their houses.
May I ask you one more quick question? How you are doing emotionally?
I'm coping with it, trying to. I'm trying to stay positive because stress is not good for our health. So I'm trying to stay positive. I'm very lucid about the situation and focused on how to act, because every single action of every single person matters now. So we have to be responsible and think before we act, and be responsible about what we do. Layla, and how we really... Sorry.
That's okay. I'm sorry. We have to let you go there. But Layla, I want to thank you for your time. I really appreciate it.
You're welcome.
Layla Bichir is a pharmacist, and she lives near Milan.